What blood sugar level is actually safe? Are you sure you're in the safe zone without realizing you're moving closer to complications? Many people with diabetes feel confident when they see an A1C of 6.5%, thinking that means they're fine. But the truth is, A1C is just an average. It says nothing about those sudden spikes to 300 or those dangerous crashes below 40. And those are what silently damage your heart, nerves, and kidneys day by day. Have you ever tested your blood sugar after a meal? Did you know that someone with a good A1C could still be experiencing dangerous blood sugar swings, what doctors call a silent killer? If you're only looking at a single number without seeing the full picture, it's like driving through thick fog without headlights. The good news is, you can take control if you understand the truth and take action. In today's video, I'll reveal 9 shocking truths about diabetes that almost no one talks about, including why many people with diabetes die from heart disease before kidney failure, and how one small change can cut your risk of complications by 30%. Are you ready? The answers are just ahead. 1. Lowering your A1C by 1% can reduce complications by 30%. Now that you've learned that an A1C of 6.5% can still be dangerous, you're probably asking, how do I know if I'm truly safe? The answer isn't in the false stability of your A1C number, but in how you manage and improve it over time. One of the most important discoveries in modern diabetes medicine is this. Just a 1% drop in A1C, for example, from 8% to 7%, can reduce your risk of serious complications like blindness, kidney failure, limb amputation, heart attacks, or strokes by up to 30%. That's a powerful number, and it shows how much of a difference even small improvements can make. Many believe that major results require major changes, but with diabetes, even small steps, like adjusting your meals, cutting carbs, walking daily, or getting better sleep, can create huge medical benefits. Lowering A1C by just 1% isn't just a number, it means more healthy years, lower medical costs, less pain, and a better life overall. Remember that 1% is not small. It's your shield against 30% of future danger, and it's 100% within your reach if you start today. 2. A1C is just an average, it doesn't show dangerous blood sugar swings. Yes, reducing your A1C by 1% can cut complications by 30%. But if you think keeping your A1C in a normal range is enough, you're ignoring one of the biggest hidden threats, blood sugar fluctuations. And here's the problem. A1C doesn't reflect them at all. A1C only tells you the average blood sugar level over 2 to 3 months. It doesn't show how high your sugar spiked after a meal, or how low it dropped while you slept. For example, someone with an A1C of 6.5% might still swing between 40 mg per deciliter, a dangerously low crash, and 400 mg per deciliter, a harmful spike. The average may look fine, but the reality is a disaster waiting to happen. And it's those highs and lows that slowly destroy your nervous system, heart, and kidneys. Many patients only discover they have nerve damage or kidney disease when it's too late, because all along, they believed their A1C was under control. So don't just track A1C. Check your blood sugar after meals, before bed, when you wake up, and any time your body feels off. Knowing what your blood sugar is doing each day is the real key to managing diabetes and staying healthy long-term. 3. A1C can be inaccurate due to other factors. Now that you know A1C doesn't reflect your actual blood sugar swings, you might be thinking, well, at least it still gives a reliable average, right? Unfortunately, not always. Here's a truth few patients, and even many doctors, talk about. Your A1C result can be skewed by other physical factors in your body. If you have anemia, recently had a blood transfusion, are taking high doses of iron, are battling inflammation, have red blood cell disorders, or even recently donated blood, any of these can make your A1C less accurate. Because A1C measures the amount of sugar stuck to your red blood cells. Anything that affects the lifespan or number of those cells will distort the result, sometimes making you feel safe when you're not, or in danger when you're actually fine. That's why you should never blindly rely on A1C. Instead, combine it with other tools, daily blood sugar checks, monitoring body signals, and working closely with your doctor. Understanding how A1C really works puts you in charge of your condition, instead of being controlled by it. That's how a smart diabetic takes action. 4. Your heart, not your kidneys, is the first organ to fail. Once you understand that A1C can be misleading, it becomes clear. Managing diabetes isn't about one number, it's about looking at the full picture. And when you do, here's a shocking truth almost no one tells you. People with diabetes don't die from kidney failure first, they die from heart disease. Most patients fear dialysis and kidney failure above all else. But in reality, most never make it that far. They suffer strokes, heart attacks, or severe vascular damage long before their kidneys give out. That's because the cardiovascular system is the first and most vulnerable target of long-term high blood sugar. Elevated glucose levels damage your cells, erode the lining of your blood vessels, clog circulation, and force your heart to work harder just to keep you alive. And here's the scary part. Even if you take medication, inject insulin, or follow a diet, if you're not protecting your heart and blood vessels, you're still at serious risk. So managing diabetes is not just about lowering sugar. It's about actively defending your heart. Keep a close eye on blood pressure, cholesterol, heart rate, and circulation, because diabetes isn't just a sugar disease. It's a slow killer that breaks down your entire body, starting with your heart. 5. You need a holistic mindset, not just a blood sugar focus. Once you truly understand diabetes, you'll realize that blood sugar control is just a small part of a much bigger survival battle. If you focus only on glucose levels while ignoring other affected organs, you're missing the chance to protect your health in a complete and lasting way. Diabetes isn't just a sugar problem, it's a complex metabolic disorder that silently impacts your entire body. Prolonged high blood sugar damages the nervous system, causing numbness, pain, and loss of sensation. Small blood vessels, leading to blindness and limb infections. Kidneys, causing kidney failure. Eyes, retinal damage. And even your skin, slower healing and infections. These issues often happen quietly, without pain, until the damage is severe and sometimes irreversible. That's why you must shift your thinking from blood sugar control to full body defense. Talk to your doctor about your cholesterol levels, liver and kidney function, nerve health, vision, and circulation. Prioritize quality sleep, manage stress, stay physically active, and make sure to supplement with essential nutrients like B vitamins, ALA, and omega-3s. Diabetes is a complex disease, but it can be controlled if you take a broader perspective and care for your entire body as one unified system. That's the mindset of someone who chooses to live strong, live smart, and live on their own terms. 6. Natural supplements can support whole body healing. Once you adopt a more holistic mindset, looking beyond just blood sugar, you'll begin to see that in addition to conventional medications, there are many natural supports that can boost your health and reduce complications. Traditional medicine often focuses on managing symptoms, lowering sugar when it spikes, or using painkillers for nerve pain. But there are well-researched natural compounds that address the root causes of diabetic damage, many of which most doctors were never trained to mention. For example, ALA, alpha-lipoic acid, a powerful antioxidant that protects nerves and reduces numbness. Benfotiamine, a highly bioavailable form of vitamin B1 that helps glucose metabolism and nerve repair. Comprehensive nerve support formulas, designed to nourish peripheral nerves and prevent diabetic neuropathy early on. Herbal supplements like berberine, cinnamon, ginseng, and turmeric have also been scientifically proven to improve insulin sensitivity, lower blood sugar, and reduce inflammation, something prescription drugs don't always achieve long-term. Of course, these aren't magic replacements for medication, but when used properly, selectively, and with medical oversight, natural supplements can become your second layer of defense, helping protect your nerves, eyes, heart, and kidneys. Sometimes, it's the simplest things that help you keep your legs, your vision, and your heart strong for years to come. 7. Your diet is your primary shield. Now that you understand how natural supplements can act as a second shield, Never forget your first and most powerful shield, your daily diet. Nothing replaces nutrition. Eat wrong, and everything collapses. Eat right, and you hold the front line. For people with diabetes, food isn't just about staying full, it's about staying alive, avoiding complications, and managing the disease. The first thing you must do is cut back on fast-absorbing carbs and sugar, including white rice, bread, sodas, candy, and instant noodles. These cause dangerous post-meal spikes and unpredictable swings that drain your energy and accelerate complications. Instead, focus on fiber from vegetables, lean protein from meat, fish, and eggs, healthy fats from avocado, olive oil, and nuts. These foods help keep your blood sugar stable, keep you full longer, and reduce cravings. Especially avoid ultra-processed foods like sausages, canned goods, and deep-fried snacks. They're not only nutrient-poor but also raise cholesterol and worsen insulin resistance. Remember, medicine controls symptoms, but diet controls the disease. Eating right lowers your blood sugar, improves your energy, and helps you avoid future complications. This is the first and non-negotiable foundation if you truly want to take your health back. 8. Regular exercise boosts insulin sensitivity. If your diet is the foundation, then exercise is the powerful reinforcement that strengthens all your efforts. Eating well without moving your body is like building a house without extra supports. It's standing, but it's unstable and vulnerable to collapse. Exercise doesn't just burn calories or manage weight, it significantly improves insulin sensitivity. This means your body uses sugar more effectively and reduces insulin resistance, one of the root causes of type 2 diabetes. Just 150 minutes per week, about 30 minutes a day, 5 days a week, can make a noticeable difference. You can walk briskly, bike, swim, take stairs, garden, or clean, anything that raises your heart rate and gets you moving consistently. And the best part? When you exercise regularly, your body responds better to food. A small bowl of rice or a few slices of fruit won't spike your sugar the way it used to. You'll have more flexibility in your diet while still maintaining good control. Exercise doesn't have to be complicated. You don't need a gym, expensive machines, or a perfect routine. All you need is a pair of shoes and a strong enough reason to fight for your life. 9. Reduce stress, sleep well, and get regular checkups. After laying down the foundations of good eating and regular movement, remember, health isn't just about what you do, it's also about how you feel and how you rest. Chronic stress is a silent killer. It raises blood sugar levels without you even realizing it. When you're stressed, your body produces more cortisol. This hormone signals your liver to release glucose into your bloodstream, keeping your blood sugar high even when you're not eating. That's why managing your emotions and mental balance is essential for long-term diabetes control. Practice meditation, deep breathing, light yoga, reading, or gentle walks, anything that naturally calms the nervous system. And don't underestimate the power of sleep. Poor sleep, late nights, or inconsistent sleep schedules increase insulin resistance, undoing the benefits of your diet and workouts. Finally, never skip regular health checkups. Monitor your A1C, kidney function, blood vessels, eye health, and nerve health. Early detection means early action, and that keeps you on the right path. Diabetes is a long battle. To win, you need knowledge, discipline, and a whole body strategy. Not just lowering blood sugar, but protecting your heart, supporting your nerves, and preserving your peace of mind. Because in the end, knowledge is the most powerful medicine, and you are the one writing your own prescription.